Good morning and welcome to Monday Mornings with Margie. I have another fabulous guest and topic to talk about today. I am very happy to have Cindy Powell Inman joining me this morning, and I'm going to let Cindy tell you a little bit about herself, and then we'll move on to our interview.
Sure. Thanks, Margie. I am a family nurse practitioner. I've been a nurse practitioner for the last 25 years or so. I work in a rural health clinic in Correctionville, Iowa, and I'm basically part of a pod of family practice clinics that are all run by either nurse practitioners, or we also have a PA in Anthem, and we're hooked to Mercy One. So we're hooked to a hospital system. And we make referrals to different specialties throughout the area, and that main hub is in Sioux City, Iowa. Okay. And so basically that's what I do is I'm a family nurse practitioner located in a town of about 800 people in Correctionville, Iowa. And so we take care of everything from newborns to geriatrics. I'm hooked to a nursing home that is right next door. So we still do old style medicine, and which has basically kind of been my goal. I grew up, my father was a family practice physician for 45 years. And so I grew up tagging along with him ever since I was probably 5 years old, running to the clinic, sewing up lacerations, helping with fractures, doing house calls, running all over the place. So I guess I developed a passion for that. He's always been my mentor. And I guess I would say I have a passion for still keeping a lot of that old style medicine in this day and age, which can be a real challenge, especially with electronic medical records and just the different way of doing things, which I would say I try to keep more of the personal touch in it. And I think so do the other practitioners that I work with. And so that's kind of my passion, I guess I would say, to kind of keep some of the old school medicine in this day and age.
And I would imagine in that kind of setting in such a small town that obviously that personal touch is important, but also you must really know the people you're taking care of.
Oh, yes. Yes. They are all like family. And I would say that the crew that I work with is fantastic. And that is so important because many of these gals that I work with, they've known the patients since they were small. Many of them, the patients were their high school teachers or their middle school teachers. And so there is a long history between the staff that I work with and the patients that we have.
That's great. That's great. So one of the things you and I were speaking a little bit about prior to coming on was sort of the intertwining of medical health, physical health, and mental health, and how they just really go hand in hand, that often people with medical issues can develop mental health issues, and often people with mental health issues end up with medical issues as well. And so I was curious, in your type of sort of family practice setting in a rural area in Iowa, how do you see your role in treating mental health conditions like depression and anxiety?
Well, that's actually a good question, Marjorie, because I would say it is very, very intertwined. And many times we'll have patients on the schedule. They're coming in saying they have maybe something simple like a sinus infection or a cold, and that's how they sign up for the appointment. But when you get in there, they burst into tears. And really what it is something that is much more related to mental health. They may have some physical ailments,
Sure.
But many times people don't often feel that comfortable right off the bat saying, okay, I'm going through a divorce, or my son is using drugs, or, something that is really becoming a real obstacle in their life. And I think family practice is really the gateway for that, because people don't often feel comfortable just saying, I need to go see a psychiatrist, a psychologist, I need a counselor, I need a therapist, especially in rural areas where you have a very, very strong sentiment of being independent and, feeling like you really don't need professional help, because that's seen as kind of a sign of weakness. So the family practice setting, to me, gets so much of that, because there's not as much of a fear. Plus, in family practice, they know us well. Sure. And we may have seen the kids, we may have seen, them for several ailments. So there's already a trust there. And so then they feel like they can come in and really spill some things that are really more about mental health.
Sure. And do you have access yourself to psychiatric or psychiatric nurse consultations? So for example, if you're, as a family practitioner, going to take on, let's say, treating depression with a first line, SSRI medication, antidepressant medication, sort of, are you in a role where you sort of make those decisions yourself, just based on your own sort of education and experience, or are you able to utilize psychiatric consultation, or do you use psychiatric consultation when it's a more severe situation? I'm just curious how that works.
Absolutely.
Yeah.
Absolutely. I feel very comfortable myself dealing with initial anxiety, depression, ADHD, some of those things. But once I have gotten to the point where I realize some of my normal medications and that are not working, I have, actually a nurse practitioner kind of in my back pocket that's a psychiatric nurse practitioner that I feel like I can call at any time, and some psychiatrists. But being a nurse practitioner, you have friendships with other people in other specialties that are also nurse practitioners. And so I feel very lucky there. And then I can get them into another provider. And that I tell you, it has been really, really helpful, because there's always new information coming out about the medications and, which age to use, or maybe, this type of medication, the SSRI, obviously is not good with bipolar patients. And so, I do have definite resources and I use them, because I feel like that's important. I don't want to be to the point where I continue someone along a road that they're not getting better. And I definitely need someone that's a specialist.
Sure. And in your area, do you have psychologists or licensed social worker therapists? Do you have one within your clinic? Like, how do things operate in your area?
Yes. I have had one in the clinic before, and that was fantastic.
I would imagine.
Yeah, it was fantastic. And we kept them really full. But I would say the obstacles to some of that are insurance. Okay. Some places that are private. Okay. They obviously, they can't stay private if they only take Medicaid patients, people that are on Title 19. And we definitely have a lot of that because it's difficult nowadays. I mean, we have a lot of folks that need that kind of insurance. So those folks, we have contacts with a couple of county agencies, Siouxland Mental Health, and we also have Plains Area Mental Health, and
Mhm.
that's out of some of the towns nearby. And so I can set them up with them.
Okay.
And, they're also trying to work out the kinks because of such a full schedule,
Right.
transportation is an issue. Transportation is a big issue. Some of these folks, they don't have gas for their car, and it's
Right.
45 minutes to Sioux City, Iowa.
Right.
And so that can be difficult. What I'd love to see is more counselors in the school system.
Mm.
And they have started some of that where they'll have a social worker planted in the school.
Mhm.
And I think that's just a fantastic idea because that way there is much better access
Mhm.
to counselors for school age kids.
Mhm. Mhm.
So
I know in Massachusetts, a lot of the model they have been really working towards, especially in terms of the Medicaid population, is within the community health centers. It's sort of like they have all the options. They have therapists, they have case management.
mhm.
Some of them have people who can help them with insurance issues. And so I think that that model in particular, it seems like it would be, a good model for Iowa to consider, especially in these rural areas. Another thing that in an interview I did with another person who was in a more rural area, she was saying that there's still a lot of stigma around mental health.
Yes.
And that there's some people that won't go to therapists in their town because they don't want anyone to see their car parked like at the office.
Absolutely.
So I was thinking two things. One is if you had therapy more access to therapists in centers like where you are, then
Mhm.
you don't know whether the person's coming in because they have a toothache or they're coming in because
Mhm.
they're struggling with a mental health issue.
Mhm.
They're coming into the doctor and it also kind of
Mhm.
integrates that whole like mental health is physical and medical health. Like
Yes.
it integrates the two versus kind of putting mental health in its own little box.
Yes. And you are 100% correct. And
Mhm.
that is why I think that model worked so well when we did have a counselor on
Sure.
site.
Yeah.
Because there was nobody knew,
Right.
and it was a beautiful thing.
Yeah.
I think also for folks that don't want to go on to a specialist, it also makes us, those of us that work in rural health, we do need to be good at even just the baseline counseling techniques,
Sure.
because sometimes they won't go
Mhm.
somewhere else. And so then I feel like I need to at least provide them with a basis where they can, continue to cope well.
Sure.
And so I feel like that, and also my nurses have those skills.
Yeah.
So if I
Right.
have some nurses that have gone through, I've got some nurses that have gone through some difficult times, and I'll say, hey, would you like to talk to them?
Mhm.
And because I know they have the skills,
Sure.
whether
Sure.
it's someone that's really struggling with death and a loss or a cancer diagnosis,
Mhm.
or I've got a gal that is, has young kids and knows how difficult it is to be working full time and having children. My nurses and staff, medical assistant, they're fantastic at it.
That's
And
great.
so I feel like you need to have, in these areas, you need to have people that can at least help with the baseline stuff.
I mean, ultimately, it should be everywhere, but you're absolutely right. Like you want people with those skills in a rural area. My hope would be that nurses and people working in healthcare everywhere would have real solid training in mental health as well. I don't think that's
Yes.
always the case, but I think it's great that you really understand it, like you really get how important it is. And I would imagine that the people you take care of, like, can hear that, see that, feel that from you. And if you're sort of passing that along to the staff that work with you, I'm sure your patients really appreciate it.
They do. Otherwise, I think they wouldn't come back. And we have a very busy clinic. And let's face it, I mean, a lot of people come back to clinics where they feel safe and they feel like they're. We always talk about how these, we want to treat them like they're part of the family.
Sure.
And what would you do? How would you want?
Sure.
To be treated if your mother was going through the early stages of Alzheimer's, or you had no time to spend with your child because you had to make ends meet and you had to work a factory job and you were working nights.
Right.
I mean, there's just a lot of
sure.
I think it's important to help people feel safe.
Absolutely.
And that they can trust you. Bottom line, confidentiality is huge. In a small clinic,
that they feel safe, and also that they don't feel alone, because often when people have depression and anxiety in particular, you feel very alone, and often you can get sort of stuck in your own thoughts, and many times those thoughts are not pleasant, or they're distorted because of the chemistry of depression and anxiety. And so just to know that there's someone you can call or go to and talk, that you're not alone with that, because maybe you don't have people you can talk to, or you're ashamed to talk to someone else. It's so important to have that connection.
And absolutely. And it just reminds me of just, when you learn about counseling people, how important that relationship, that really is the key. Is the relationship between the two of you, and that there is trust, and they know that they can talk with you, and that you will listen, and that you will care, and you will give your best, your best advice. And sometimes it's just listening.
Yes. That's so true. It's so true. So what are some of the resources that do exist, and what are the resources that you feel like would be helpful? I mean, I think we talked about some of the resources that would be helpful, whether it's, on sort of a micro level or even a macro level. I know there's a lot of people I've spoken to in the mental health field within Iowa talk a lot about advocacy at the state level as well.
Yes.
There's sort of micro things that are helpful and more macro things. But what are some of the things that you think are going well, or that there are resources for, and where are the areas that you feel like Iowa in Iowa is just one state in many that need changes. So I'm not picking on Iowa.
No, I understand.
That's where you are. So what do you think? What are your thoughts on that?
Well, I tell you, I live in an area where there's not that much diversity. So folks that maybe fit into categories, like, let's say the category, gender issues, that type of thing. Those sorts of situations, folks can feel very alone if they're having some gender issues, or let's say they're homosexual, those kinds of things. I try to plug them in to resources in the city where they definitely will not feel so alone. Get them with some specialty people that can deal with some of those very difficult issues when they might feel like they're on an island, in a very small town. Sure. And I hope that I think I have the reputation now, because I've been there so long, that they understand that those are not things that I have a problem with, and that I understand that that can be very, very difficult to grow up in a
Mhm.
community
Mhm.
where you feel alone.
Mhm.
And so I guess back to your question, I think those kinds of things, we need more resources
Mhm.
for people to understand those issues more.
Mhm.
I have to, like, if someone has a particular gender issue, there's some specialists in Sioux Falls. Well, that's, an hour, maybe an hour and a half away from Correctionville.
Sure.
And so they have to have transportation.
Mhm.
So, but I have some connections where I can seek places out for people to go.
Sure.
Um, uh, the other thing that we touched on a little bit before that I think would be so important is to maybe even get a crew of people that are planted in the small rural schools, that are counselors,
Mhm.
that know how to deal with some of these issues, and that are very open to all kinds of difficulties
Mhm.
that students face.
Sure.
And that I think is huge,
Yeah.
because it may be that they are having issues with their parents divorce, or whatever it would be. The school is a place where they might be able to go in a study hall and
Mhm.
talk with a counselor.
Mhm.
And where you don't have to have everything set up, where there's insurance, where there's, it's
Sure.
just basically a service.
Yeah.
And they might have that in some of the bigger schools in the
Yeah.
cities, but we don't have that in the rural area,
Right.
you know.
And
um
also you're tackling stuff that may, if dealt with at a younger age, will not progress into something bigger as they get
exactly.
older. There can be
Yes,
interventions made that may stop how this progresses, or at least
absolutely.
start addressing it at an early enough age, so that the teenager or their child kind of understands this is what's going on with me, versus figuring it out when they're 30 or 40 or even 50.
Yes, absolutely. And
Mhm.
I think getting more education,
Mhm.
just even talking about that particular issue. One of the videos that I suggest that parents and kids watch when we're talking about gender issues is, there was an interview by Katie Couric, that Gender Revolution.
Mhm.
And I wish some of those types of things could actually be shown in the school, so that
Mhm.
there's more education
Mhm.
around that
Mhm.
and the biology of it. And because folks in the rural areas, I mean, unless you travel outside of that,
Mhm.
you don't have a knowledge of what some of these kids are going through.
Sure. Sure. Yeah.
So because and I'm not blaming them. It's just has never been part of their life, you
Yes.
know.
Yes. Yes.
So that's
Yeah.
just one area. But
Okay.
I guess the one other thing I wanted to touch on too was the isolation piece. When you're working in a farming community, there can be some isolation. I take care of a lot of old gentlemen that may have lost their wives, that
Mhm.
type of thing. And
Mhm.
so, and they are very, very independent.
Mhm.
And they don't want to go see a counselor. I mean, no way, Jose. They do not want to go see someone outside for mental health, because that's seen as a weakness. But
Mhm.
they will come in and talk to us.
Yeah.
And so then we can decide, you know what, this person is really in danger of, you
Mhm.
know,
Mhm.
severe depression. And then you have to help them learn that taking maybe a medication would not is no different than treating their high blood pressure.
Right. Right.
And so, as in family practice, I think you can sort of sway folks to try some of those things. And I tell you what, it can make a huge difference. I mean, I will see someone, I always check up after starting medication in 1 to 2 weeks.
Yeah.
And the change that can happen just with the brain chemicals,
Mhm.
where they are like, oh my goodness, I should have been on this like 20 years ago. Or heck, if I'd have been on this, I
Right.
might not have gotten a divorce, or, something like that.
Sure.
And
Sure.
that is very uh that feels really good to be able to help someone in that way. Probably even more so than treating them with a antihypertensive, you
Sure.
know, because you can kind of get that anywhere, you
Right.
know.
Right.
But to actually have someone trust you enough to say, okay, I'll try something for my mental health,
Yeah.
you know.
Yeah. Yeah. No, I mean, you bring up a lot of good points, and I feel like the fact that people have access to a clinic and somebody like you right in their area is really key. And I think you're right. I think you guys in some ways are a place where you're really kind of a hub for a lot of things, from medical health, mental health, education, you know, joy and pain and all of the above. And so, it just speaks to like, as a country, how do we invest more? It seems like there needs to be more investment in rural healthcare, and there needs to be more investment in urban healthcare, and that there could be a lot of changes made if we could sort of target how we do things
Yes.
in a much more
Yes.
meaningful, directive way.
Yes.
We could be helping so many more people in a wide range of areas.
Absolutely. And one of the things I am thinking about as you're speaking about this, in terms of how we do things, how do we deliver care? For me, I feel fortunate that I actually got to be a part of what I would call the old school medicine, where you did not have a computer in front of you. Okay. And so I learned that way, and then you'd come out and dictate. Okay. Sure. And whereas when we got a computer system in 2012, I remember that. And of course, my nurses would probably laugh because I didn't handle that change very well at all. Okay. And and because I felt like one of the main things when you're taking care of people is that you actually are looking them in the eye. You're actually talking with them. You're actually, it's like having a conversation with a friend who's on their phone. You know, I mean, so the delivery of care, I feel like, is something that I think needs to be worked on, because that computer, there are some fantastic things about it. I would never say we go back to the complete old style. But I think there are ways that we can deliver the care where our patients will feel much more connected to their provider, whether it's their specialist. And quite honestly, sometimes specialists can do this better because they only have one area to focus on, you know, and so they have one thing to hone in on, and their memory might be good enough to be able to go back out and, finish up a chart. Yeah. But when you're in family practice and you have lots of things that you're listening to someone, they might spill out about 4 problems. You know, if you're typing in, and some people do it better than others. I've got a couple of colleagues that do a great job of it. And I'm not one of those that does that very well. So I just think we need to be very aware of that. And some people are better at it than others. But I will say one of the biggest complaints I get from people is when you send them to other providers, if they're not listening, if they're on their computer the whole time, then that's very distracting. But like I said, I have to say there are some people that are good at it, and the colleagues that I have, I've got a couple of them that do very well at it. But I just think that's an issue: the delivery of the care, and how do we document, and how do we still help people get a sense that they're being listened to, and that it's not all about how we document and how we bill.
Yeah. So. And I think, yeah, I mean, I think that's without saying, and anybody in healthcare totally understands that. And I think at the end of the day, right, it's about relationships,
Absolutely.
No matter what job you're in, whatever field you're in, whether it's with your family, whether it's with your colleagues, whether it's with the people you treat, it really comes down to being in a relationship that you feel connected.
Absolutely.
And at the end of the day, that's what we're all looking for. And
absolutely.
I'd like to just go back to, you know, you're talking, and we can wrap up, but I just want to touch on this. You're talking about young people with gender identity issues, and with members of the LGBTQ plus community, and myself being a member of that community. It made me feel good to hear what you had to say, because I know there are kids out there who are really struggling and don't have a you to turn to. And so it feels really good for me to know there's you out there that wants to help and wants to educate, so that some of these young people don't feel like they only have one option. And you and I know what that one option is, and it's not a pleasant one. And so I just wanted to sort of just say that and acknowledge that, because it's so key right now, and we need more people in healthcare like you, and especially in more rural areas, so kids and adolescents and young adults aren't feeling isolated and like they're the only ones and that nobody accepts them. So
yes, well, I can't tell you how important I feel that is. You know, I really do feel that's very important.
Yeah.
Mm-hmm. And I would have to say that I have to just say I go back to my parents on that one. Mm-hmm. Because they're very open, loving people, and I feel that I grew up in an environment where you know, you really got the sense that being non-judgmental and trying to understand people that are different than you, mm-hmm. and politically, religiously, mm-hmm. Whichever way it is, sure. that is the key.
Yeah. Well, they did a good job. Your mom.
Oh, well, thank you.
Your mom and dad did a great job. And I appreciate really you taking the time out of your busy schedule to spend this time talking with me and, you know, sharing this. And part of me doing what I'm doing is to put out there, you know, to all different listeners. So we're all learning, right? We're all learning about different people, different parts of the country, different kinds of communities, different issues around mental health. And really that's, I guess, part of our mission with this is really just to continue to learn and educate and talk about the importance of building relationships. So I appreciate taking the time today to do this.
And I really appreciate you inviting me on, and it's been a pleasure to talk with you.
Thank you very much. So thank you to all our listeners. I hope you enjoyed our discussion today, and I will be talking and seeing you soon. Take care.